Hello, I'm Dr. Julian Schink. I'm the Chief Medical Officer at Cancer Treatment Centers of America, and I've been a gynecologic oncologist for over 30 years. I also serve on the Scientific and Medical Advisory Board for NOCC. I'm here today to help answer 3 questions about ovarian cancer and precision medicine. The first question comes from Susan in Phoenix. I'm hearing a lot about precision medicine. What does that mean for ovarian cancer? Precision medicine, which is often called, or also sometimes known as personalized medicine, means that we specifically test the tumor, the patient's ovarian cancer, for genomic mutations that we can target with specific therapy. We also look at some other predictors of response to immuno-oncology drugs, things like PD-L1 expression and tumor mutational burden. And that allows us to tailor a treatment specifically to that patient. Opens the door to many new drugs, some of which have really exciting treatment effects, really effective drugs. Now, doesn't mean everyone qualifies for that. In fact, quite the contrary. With ovarian cancer, it's actually a small fraction of people who will identify a really valuable mutation. But that said, if you're one of those people, it can be incredibly valuable. Second question comes from Amy in Northern Virginia. Does every woman with ovarian cancer receive genetic and genomic testing, and what's the difference? Great question. Genetic testing looks at the genes that you inherit when you're born. Genomic testing looks at the genes in the cancer after they've mutated because of the cancer. There can be a very big difference between the two. Now, it is recommended that every woman with ovarian cancer have genetic testing. That can help identify specific genes. The most common specific gene to have a mutation in ovarian cancer is BRCA1 or BRCA2. And those are present in about 10% of women with ovarian cancer. Critically important, both for the patient with the ovarian cancer, because they help us in some of our treatment decisions for that patient about which drugs to use, when, and for how long. It also is important to that patient's family because it can help them better know what their risk is and things that they can do to prevent ovarian cancer and possibly even breast cancer. So genetic testing, absolutely recommended for those folks. Now, genomic testing is the gateway to personalized medicine. And while it's not generally performed or not strongly recommended to be done on the front end of treatment for ovarian cancer, people are doing it earlier and earlier just to open the door and identify what additional treatment options there are out there. The last question today comes from Jane in San Antonio. How can I find out if there are treatment options or clinical trials that would work for me based on the results of those personalized medicine tests? Well, fortunately, the companies that do that personalized medicine test include a comprehensive report with the results of that testing, and it includes any available clinical trials in the United States that mutation might direct the patient to. So it's great reporting. Furthermore, most of us treating ovarian cancer patients and using those tests have clinical trials open specifically targeting the more common mutations. Thank you today for watching. Please, below this, in the comment section, add any additional questions that you might have that we could use in the future for the next 3 questions. And have a great day. Thank you for your attention.